Vaccine rollout has not been smooth sailing. One home care provider reached out to News 5 saying he and his employees were left out of phase 1A vaccinations. Kevin Barry found out it may have been a miscommunication and helped him get on the waiting list.
As soon as COVID vaccines got to Ohio, David Sanchuk says he was trying to get his employees at Synergy Home Care of Broadview Heights vaccinated.
We cannot keep social distancing as we're taking care of people, feeding them, dressing them, bathing them.
And yet, he says he was told multiple times that his workers weren't included in phase 1A.
My reaction was amazed. We're in healthcare. We're taking care of the elderly, the highest risk group.
When we started to ask around to county health departments, News 5 found that David and his employees probably were included in phase 1A, but might not have been at the very front of the line.
And so there is a lot of room, unfortunately, for miscommunication.
Summit County Health Commissioner Donna Skota says her staff was vaccinating home care staff like David and his employees alongside other medical personnel, but other counties he reached out to might have been handling their vaccine supply differently.
Each county is uniquely different with the priorities, and some have been able to include groups that others have not, just because they didn't have enough vaccine and they had too many of the other groups.
Like EMS first responders or hospital staff that some communities were trying to vaccinate before home care providers like David. But since county vaccine supply is reserved now for Ohioans 70 years and older and school staff starting tomorrow, finding vaccines for healthcare providers can be hard. That's why Skota is considering makeup days for frontline workers soon. After we connected David and Donna today, his employees were able to get on a wait list to get their COVID vaccines in Summit County. Donna hopes to start those makeup dates in the next few weeks if there's enough vaccine supply, which is important because she says there's been a lot of interest in those makeup days.
I honestly think that a lot of people are starting to come around and think, I better take something.
She thinks early vaccine hesitancy among healthcare staff members is starting to melt away because so many of their coworkers got the shot and didn't have major side effects.
If it's offered to you right now, that's like winning the lottery. You should take it.
And that's how David says he and his employees feel about it too. If they have the chance, he says, they're taking it.
And I know almost every employee I have would be running down there and getting it in a heartbeat.
In Cleveland, I'm Kevin Barry, News 5.